does functional neurologic disorder get better? Does it go into remission? Does it go away? These are the questions that I get really on the daily. And I want to say hello to Christy, who just joined, because I just chatted with you. Hello. And thank you so much for joining me for a little bit of a research discussion today. My name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of re+active Physical Therapy and Wellness. I'm in the Los Angeles area, where finally it is not as hot as it was the last time I did this, so I'm very thankful for that. Oh my, I'm also standing on my treadmill desk, and it just slid, so maybe I should be a little more cautious here. Just so thankful to be able to chat with you. By the way, if you have questions, put them in the comments and I'll try to get to them today. But this is a question that I get so frequently. One of my roles at re+active is to do consultations with people who might be doing a program with us for any of our programs: functional neurologic disorders, concussion, dystonia, stroke, Parkinson's, so on. But I do a lot for people with functional neurologic disorders, and I did a couple this week, and this question came up in both of them. And of course this question would come up because people are pretty debilitated, disabled by their symptoms, and they want to know, can it get better? They want to know, can I recover? Does this go into remission? Do the symptoms go away, or do they last forever? You should be asking that question, right? That's what you want to know. And I have a very nuanced answer, I will tell you. Yes, you absolutely can get better. Yes, for some folks, the symptoms go completely away and they're in remission. And for as long as I've known them or heard their story, they're still in remission. I haven't followed anybody for their lifetime yet. I'm getting older, but I'm not that old. So I haven't followed somebody forever to know if their symptoms go away forever. And I want to share some of the research on this as well. I'll tell you, we'll dive into 2 studies today that just came out this year. But I want to tell you clinically what we see. When we see somebody with functional neurologic disorder, first of all, it's often not the only thing they have, right? So some of the very common comorbid conditions are migraine, or POTS, postural orthostatic tachycardic syndrome, or hypermobility disorders, or autism, or another neurologic disorder. And a lot of those things are with you for life, right? And actually, for some of those things, you're not even trying to change them. You want to actually accommodate to life, to what you need. And particularly, I'm talking about autism. For the person with autism, we're really trying to, if they have sensory sensitivities, we're going to help them live with those sensory sensitivities. We're not going to try to take it away. So that's what I mean by some other disorders. Others we're going to manage, right? So POTS doesn't just magically disappear. If you have a genetic connective tissue disorder, it doesn't magically disappear. You manage it, and you manage it for your life. And sometimes when we see functional neurologic disorders, it's actually a little bit of a signpost of something else that has been happening. Something in the sensory system, something in the motor system or autonomic, and the FND has developed. So yes, we can actually very much improve and decrease, and maybe even those symptoms go completely away. But that person still has POTS, and person still has hypermobility. We need to manage those. The person is managing them, and they can manage and live very well with them. And somebody actually asked to find remission, literally back to how they were, or is it better managed that nothing happened? That's a really good question. So a lot of people want to get back to where they were. For some of those folks, back to where they were ignoring some signals in their body. And once they realize, wow, I've been ignoring that for a long time, and I actually need to tune in and take care of my brain and body a little better, they actually don't want to go back exactly to where they were. They're actually quite happy that they've learned something about their brain and body that they needed to tune into and take care of. So yes, most people want to get back to living, right? They want to get back to life, which I think is the better question than asking about does everything go away? Getting back to life, getting back to work, getting back to driving, getting back to going out of the house, getting back to going out to dinner, getting back to eating, getting back to going for a walk, getting back to caring for your kids, getting back to cooking. Those are getting back to life. And absolutely, and again, I'm going to talk about a couple of research studies here, people get better and people get back to life. Now, there's variability in it, just as there's variability in FND. We see people that are completely paralyzed, having dozens of seizures per day, can't eat, can't see, can't speak, can't feel or move their body. We see kind of the most extreme, I think, of cases. And then we see some people that might have some tremor, or they might have dystonia, or they might have more isolated symptoms. And everybody's a little bit different. And so the prognosis is different. And in the research, there are some things that show a person might have better prognosis. So having less symptoms, you might have a better prognosis as far as recovery and improving. Having symptoms for a shorter period of time. But hey, we've shared a lot of folks who've had symptoms for 12, 20 years who still get better. So, I mean, if you know me, you know I'm like, don't give up hope. And that's not just for FND. I mean, that is across the board in neurologic disorders. We know that people can improve their quality of life, and that the brain can change, is capable of changing. So that's really hopeful news across neurologic disorders, not just in FND. But with FND, there's still so much that we don't know. Even the studies that I'm going to share today, they're still really small, although one was published in JAMA Neurology. I think it had about 40 people in it. They're getting bigger. We're getting better outcomes. We're getting better ideas of what's happening, but we know a little bit less than we do about some other disorders that have been studied for a long period of time. So really great question about really what remission is. But yeah, getting back to walking, the simple things. Neuroplasticity with an exclamation mark. I am a neuroplasticity cheerleader for sure. The other thing that I want to say about this question, which is like, again, I said, you should be asking these questions like, what is the hope for recovery? What can I expect from therapy? You should be asking those questions. One of the things that I've also found is that when you are working extremely hard to get rid of something. So I want to get rid of this tremor. I want to get rid of these seizures. I'm so terrified to have a seizure again that I am desperately trying to get rid of it. Which would make a lot of sense. Of course you would be trying to get rid of it. Sometimes that effort and exertion to get rid of actually can ramp up the nervous system. And it's not causing the symptom. Okay, so that's not what I'm saying. But that effort and drive can really kind of set you up for battle. It's like you're doing war with your symptom, which kind of makes sense. You kind of want to go to war with your symptoms. So it totally makes sense that you would be doing this. But sometimes that actually really ramps up that fight or flight or sympathetic drive, and it can actually worsen symptoms. And so it's not that we're not going to go to battle or not go to war, but we may want to switch our focus to living, right? So yeah, as Paris Arc 34, I always love everybody's name. Agreed. Effort to have symptoms dissipate can make them worse. So thank you for saying that. I'm saying what I see. I also live with a long-term autoimmune condition, and I've actually been there really, really focused on my symptoms and trying to get rid of them, and it made my symptoms worse. So I know that, and that's not just FND, by the way. That's many, many things. Pain is one of them. So the question, the inclination is valid and normal. Absolutely. I think the better question is, can I drive again? Can I walk again? Can I get back to life? And very, very often, more often than not, yes, you can. There are some clear ways now in research that are telling us how we can do that. And the reason I say, yes, you can, is because I've seen it. Now, does everybody get there? No, I've seen people also not get better, but I've seen a whole lot more folks get better. So I want to share two studies. I shared this today here. I think it's these two studies. So the first one, this one's out of JAMA Neurology, very recent, published in August, so just last month of 2024, and this was called Combined Physiotherapy and Cognitive Behavioral Therapy for Functional Movement Disorders, a randomized controlled trial. Not very often that we get a randomized controlled trial, so this is exciting. Not very often that we combine things, so this is also exciting. This was done in Spain. So the first author, last name is Macias Garcia. And I'll stop sharing this for a moment. But let me share what they did in this study. And again, this just came out. So they looked at patients with functional movement disorders. So these would be people who have weakness or tremor or dystonia, something involving their movement. And they enrolled 40 people, ranged from 18 to 66 years old. And they usually have the mean time of having the disorder. And I thought I highlighted that, but I might come back. But they followed them for therapy, and then followed up at 3 months and 5 months, because that's another question that people ask me is, I might get better now, but is it going to come back? And we don't have good predictors of that, but typically a study is going to do a follow-up to see how people are and where their symptoms are. And we see a range. We see some people who might have a flare of symptoms, but they have a flare and then they get back because they know what their brain and body needs. We have people that they go back and then they're getting better and better, and then they try something new. They go back to work and they have a flare of symptoms, and so they might need new strategies and techniques for a new environment. That's totally normal in a lot of neurologic disorders to see. And so the expectation is, something could flare, something could, quote, come back or change or evolve. But when you have gone through a therapeutic approach to learn about your brain and body, you know what you need to do. And so you can go in and live life and maybe take a little more risk, or just understand what you can know and do, and without the fear. And that's really, really big when it comes to our nervous system. Okay, so back to this trial. Let me tell you what they did. So they had, it was a randomized controlled trial. So they had two groups so that they could compare them. And one group did psychology and physical therapy, and the other group just did a psychology support group type thing. And I think I have these numbers right, but they did in the psychology treatment was group-based cognitive behavioral therapy, and they just did 4 sessions. And then they also did 12 physical therapy sessions in an outpatient setting. So that was the combined group. And then the other group just did 4 group sessions. They weren't cognitive behavioral therapy. They were more like a support group. And then they did assessments at 3 months and 5 months after the study. So I'm going to pull up the table. I think it's going to be tiny for you to be able to see what it looks like, because it's even tiny for me, but I'll at least show you here what it looks like. So here's the table of outcomes. So they looked at comparing groups, right? This multidisciplinary group and the control group. And then they looked at changes at 3 months and 5 months. And they used outcome measures like the clinical global impression of severity. They looked at the SF-36 mental and physical components, the EQ, which looks at overall severity. And I'm going to show you a graph because I think it'll show up a lot better, because you're going to see how much better the group that got combined treatment did. So 2 graphs here. The blue, like the blue and gray, is the multidisciplinary group, and the dark is the 3-month, and the lighter is the 5-month. The orange is the control group. So what I like about this graph, it shows the percent change from baseline, and you can see the control group is below the graph. They actually got worse. So they had a support group, which is great, and actually had some improvements on a couple of things, but in this one, in these measures, they got overall worse. And then you can see the multidisciplinary group got better. So the SFMDRS is the amount of motor symptoms the person had. This is the percent improvement. The CGIS, this is their global impression of severity, also better. And then the I don't even remember what that one is. The ZARET is the caregiver burden scale, also got better. And then what you can see, so basically comparing the groups, the group that did the multidisciplinary treatment, physical therapy and psychology, got better. Now, I think they're desperately missing OT, but that's more than my opinion. I think that one's a fact too. We've had some great OT studies too. They would have gotten even better, I would say, if they had OT in the mix of there. And then the graph on the right. So this is the patient global impression of improvement at 5 months. We also do this measure for people, and what you can see is the multidisciplinary in the dark color, and the orangish color is the control group. And so this scale goes from I'm worse to I'm very much improved. So you can see the blue, most people in the multidisciplinary group were very much improved, or slightly improved. And most people in the control group were slightly improved, no change, slightly worse, or very much worse. So a clear distinction between the 2 groups, although I will say, hey, slightly improved is looking pretty good for the control group. At least get connected to a support group, right? That would be the moral of the story, to keep your progress even going a little bit forward. We also use this in our program. So we use the patient global impression of change, and our average for all of our folks with FND is a 6 out of 7. So much improved. So, and that's hundreds of people for us as well. So we can see that this multidisciplinary program, which was not a ton of therapy, it was 4 group sessions of psychology and 12 individual physical therapy sessions, improved people's lives. And That is pretty great. Now, of course, there's limitations to this. It's still a small study. So it was 40 people overall, but that's only 20 people per group, right? So we still have a long way to go with this. And, you know, I would say this is great, multidisciplinary, but we should have OT in there, and speech therapy if the person has specific speech symptoms as well. So that was one study. The second study here, because I don't have any graphs from this one, but I just want to bring back the title for you all. By the way, if you're not on our newsletter already, I'll send out the links to these articles. I send out the videos and all of our resources every week. So this one is the one that is highlighted at the bottom because I just have my highlighted copy. This one's from the Journal of Neurology, also from 2024 in January. And this one's called Routine Outcomes and Evaluation of an 8-week outpatient multidisciplinary and rehabilitative therapy program for FND. Very cool to see. And this one, I believe, is out of the UK. It is. So there's an FND program at the Bethlehem Royal Hospital, South London. So this is where this is from. And they looked at, let me stop sharing here. They looked at their 8-week program. And this included individual physical therapy, cognitive behavioral therapy, self-management sessions for folks, group physical therapy, and some education. So that's a lot of pieces. Again, I think OT is missing, but that's a lot of good pieces. And boy, like, I know I keep saying OT, but that's because I really believe in OT, and it's been shown to be really effective, especially for sensory, the sensory system in FND. But hey, this multidisciplinary approach is certainly better than things that we have seen. So what they did is they looked at outcomes at week 1, week 8, and a 3-month follow-up. And these folks had improvements. They had statistically significant improvements. I'm just going to pull up the table here in all of the outcomes. So they did an anxiety inventory, that improved. A depression inventory, that improved. The work and social adjustment scale, that improved. The 10-meter walk test improved, and the timed up and go test improved across the 8 weeks. And again, really, really great outcomes. And they actually, this program had a name. It's called the FIND program. And they developed this specifically because it's been learned that multidisciplinary treatment is beneficial in FND. And so now they're showing the benefit of that. Now, again, there are limitations, right? So this was just looking at, it was not a randomized controlled trial, so just looking at the data that they had. But a very, very good start for us to see that people get better with functional neurologic disorder. Now, I don't have, I didn't bring a picture of this other article, but I have to talk about it because this was in kiddos with functional seizures. And I've talked about this study before, and I'll put it in our newsletter. So if you're not already on our newsletter, if you're a patient, you can join at reactivept.com. If you are a clinician, you can join at reactiveeducation.com. This one was called the REACT trial. I wish it was done by us because that would be a great name for a reactive trial, but it was not. This was done looking at regaining control and attention in kids, so pediatric functional seizures. And I bring up this trial because with this intervention, it's at least 80% but I don't have the study in front of me because I'm just talking off the top of my head here, but at least 80% of the kids became seizure free. No more symptoms. And that is huge. And what we see actually in pediatrics too is that kids can become symptom free and, like what I would say, quote, go into remission. Now, does it mean that they don't need any support? Probably not. Does it mean that they can just ignore their sensory system? Like, none of us humans should do that any longer, right? It shouldn't ignore the sensory needs that we might have. We shouldn't ignore our autonomic nervous system. If a kiddo started having functional seizures because they have POTS, they're going to need to manage their POTS. The good news is those things are manageable, right? So there's a lot that we know that we can do from a lifestyle approach and things like that can be beneficial. So I just bring that up as another piece on the can people get better? Research and studies have shown that people can get better, even 100% better, even symptom free. And very likely what each person needs is a little bit different. It's probably going to be an individualized approach. That would be my bias. I don't think that there's one manual that's going to fit a one size fits all approach that works for every single person. But we're learning a lot from these studies about some of those components that can help. And that these studies, so the other thing that I would say, when I was writing my chapter for physical therapy textbook on pathophysiology and FND, I looked at a lot of the research regarding the prognosis, the outcomes for people with FND. And there's a couple of early papers from the 2012s, 2015s era that say prognosis is really poor. People get worse. And that is the prognosis without treatment. So if you just naturally follow people along from one neurology visit to another, they found that about, I think, actually, I can pull up the chapter here for you. 39% of people with motor FND are the same or worse at follow-up. This was a systematic review from 2013. This is not treatment. This is just follow-up. So treatment in functional neurologic disorders is really, really important, and people get better, and especially with multidisciplinary treatment. Now, there was a question here. So I'd love to answer your questions. And I want to remind, if you are a clinician working with people with FND, I care very deeply about you, just like I care very deeply about people with FND. And every year we do an updated, brand new workshop on functional neurologic disorders for clinicians. We also do this for patients. This one's for clinicians, and it's next Tuesday night. It's at 5 p.m. Pacific time, but we'll record it as well. I would love, love, love for you to come. We're going to update you. We're going to tell you the latest. We're going to talk about treatment and really give you some things that you can help that next patient with, because all of our patients really deserve your expert care. So you can sign up for that at reactiveeducation.com/workshop. And I really, really would love for you to come. But I want to answer questions. So if you have questions, put them here. I'm going to scroll because I thought I saw something about braces and otoliths. Well, Alyssa, what an interesting question. So can braces cause dysfunction or disruption of the otoliths? And when I saw that, I was like, yeah, it kind of makes sense. So one of the things that can happen with braces or other infections around the teeth or gum or other just issues with the jaw is you can get symptoms through your face, your jaw, your neck, and that can certainly affect the ear. Now, is there a study on this? No. I've not ever seen a study. Now, I might have to look for it, but I've not ever seen a study for this. But the otolith, that small inner ear organ that senses gravity or graviception, is highly impacted by how we move, and our neck, and our eyes, and all of these pieces are integrated. And I talked to two people this week about how the integrated function between all of these systems is so important. So for example, if you were finding that you got dizzy after you got braces, that person should not just be looking at the jaw and the mouth. They should be looking at your neck and your eyes and your vestibular function or your otolith function, and integrate all those pieces together, right? And I'm not sure where that question came from, but that I also just want to kind of support that sometimes we see these symptoms develop after a series of things occurring. It's often not just one thing, but it's a series of events or a series of injuries or a series of illnesses or infections or some combination, because our brain is plastic and it changes in response to all of this input. Now, the other thing, I'm having a hard time seeing these comments. I'm so sorry because I see one up here. Here's the good news. This is, when we think of functional neurologic disorders, I kind of think of neuroplasticity as kind of gone awry. It's run amok. It's doing stuff that it shouldn't do. But the possibility for changing that, for reversing some of that, for developing new connections is there. Someone else is asking, so let me make sure I'm getting these. Thanks for that great question, Alyssa. A while back, I saw something about neuroinflammation in FND. There was a research article about it. Yes, there is. I was hoping you can generally share what that was about. If you're aware of the study, I'm going to have to do another live on it. I did read that study, and it wasn't astounding to me. I wanted a little bit more, which is why I didn't do a live on it. But there has been one review looking at autoimmune pieces and one looking at neuroinflammation, and I'll bring those pieces together in another live. It's a really, really good topic, which, by the way, these are topics that I really love, and it's one of the reasons we created a membership community for people with functional neurologic disorders. So if you're a person experiencing FND, I highly, highly recommend this community. First of all, it's a very, very positive, hopeful place to be if you have FND. We do an education class every single week on Zoom with our expert team and people with FND. And we get to talk about this research. We get to talk about the pieces of the pie and how they come together. You make your own pie chart. And it's probably one of the most favorite things that I get to do. So anyway, I say that because if you love diving in and learning this stuff and you have FND, I think you should join our FND membership. You can join on a monthly basis. You can join for the year. And we actually do 6-month wellness evaluations with you from wherever you are in the world. It's really great. I love it. I love it so much. It's given me the opportunity to meet so many of you. But this is a great topic, and I'm going to actually write it down so I don't forget, because sometimes on Fridays I don't have any brain cells left and I forget things. So I'm writing it down. Thank you for that. And somebody says it really is a positive and educational group. That was a big purpose of our FND membership, was to have a place where people are very positively supportive. Doesn't mean they don't have symptoms. It doesn't mean things aren't happening for them, but they're getting the support and they're not alone in it. Ooh, another great question. Ooh, this is telling me autonomic. Do you have a biological mechanism behind having a hot head? Feels kind of like a fever during a flare-up. I don't know what the mechanism is for you, but when I hear that, I'm definitely thinking autonomic nervous system, which helps our homeostasis and temperature regulation. And I'd be testing that out for sure. As soon as people say, somebody else said to me today, like, I run very hot. I also run really hot, and I know it's my autonomic nervous system too, and I have good ways to regulate it. But I'd want to test that out for you and see what it is. Or if you're working with a physical therapist, a physio, you might ask them to look at your autonomic nervous system. Oh, Shane, I wonder if my live video is not working. Let me know. I'm sorry if we've had some bumps in the road with the live video. But it is Friday. And now, just past 5 p.m. my time. Thank you for saying it was working for you. Okay, thank you. I wanted to say thank you so much for the great questions, for being curious about the brain and body alongside of me. That drives me so much. But also, your questions, your life, your getting back to life. That really drives me to learn and grow more in the field of neurology. So I just want to say thank you. You share a lot with me, and I learn a lot from you. If you're one of my fellow clinicians, please come and please share. And in fact, if you have FND, please share about our free workshop next week. I've been working on this. We've been updating things. We're going to share cases. We're going to go through our pie chart. We're going to give clinicians very concrete things that you can do to help your patients get better. And we've really updated it, and I'm really excited about this. So it's next Tuesday. I think that's September 17th. Yes, it is. So next Tuesday, 5 p.m. Pacific time, but we'll also record it. So please share with your fellow clinicians, and I will see you there. Have a wonderful, wonderful weekend. And again, I'll send this all out in my newsletter this week. Thanks so much, everybody.